systems are not built for those types of things. Nor, I think, in the past have girls been necessarily educated, given the leadership skills from an early age, believing things like they can be good at math, they can be leaders of organizations, they can be CEOs. Yeah. I think we're shifting from the first generation or early generations of women's leaders, women leaders who felt they had to sort of show up in a male conditioned way. And I think I'm like that sometimes. I feel better when I show up in a jacket, you know, at a meeting. It makes me feel more confident at a table that I have a right to be there. Silly, small things like that, but they matter, you know, when your leadership is put to task. I think we're shifting from that sort of space, this first generation of women who really led the way for us, to second and third generations of women who are understanding that we can bring our uniqueness, our own individual experiences, our femininity, all of that, and still be just as successful as anyone else.
Leader. I hear that. And when you mentioned that, I remember a few years back there was this conversation about if a woman, a leader, right, shows up in a dress, there's a certain way that she's perceived. But if she shows up in a suit, there's some level of respect that she gets. But that, again, thankfully that has shifted.
But really, I did want to jump in on that question that you asked about what are some of these barriers that women face in getting to the top. I think one of the top barriers for women, especially in countries such as ours, is what I would call the motherhood penalty. Right?
Okay. All right.
The reality is that, you know, somebody has to bring forth the next generation. That burden falls squarely on women in terms of carrying the pregnancy to term. But it also comes with a lot of consequences for women. I remember a very good friend of mine telling me that, you know, very excitedly she'd gotten a job, good job, in one of the top hospitals in Nairobi. And a follow-up on that is that, you know, she required to do a medical checkup. And they did a pregnancy test and realized she was pregnant, and the contract was cancelled.
Oh no.
I think that was maybe about, I don't know, 15 years ago or so. But that is not rare. That is not rare.
It still happens in some instances.
It still happens a lot, right? You know, there's just a lot of caregiving around motherhood that is involved, carrying a pregnancy to term. I remember, for example, a few years ago when I applied for a job, pretty senior job. I was 9 months pregnant. In fact, the interview was on a Thursday, and I delivered on the Monday.
Oh wow! Okay.
And, you know, I remember asking some of the senior colleagues in that organization that I'm thinking of applying for this job. What do you think? They're like, you're pregnant. Like, you're really pregnant. You're away for 3 months. You can't get this. And at the end of the interview, I was asked, so, Anne, do you have any comments for us? And I just said, if I'm the best person, you know, from your interview process, don't let my pregnancy stop me from, I made that very clear. If I am the best, I did get the job. And I think that's partly because there was a female CEO in the organization at that time. But the reality is that for very many women, they wouldn't even consider, you know, going for such an opportunity. And therefore that continuously, people go hiding, wearing big heavy jackets and so on. The moment, you know, it's realized you're pregnant, you're cut off. Or even women who do not have children may not be given certain jobs because there's an anticipation that very soon they'll be going for maternity and so on. So this motherhood penalty, you know, it's a term coined, I think, by women in global health. You know, it's something that really needs to be addressed at the workplace. Lactation, for example. I remember after delivering, no, it was actually during my first pregnancy. And where I was working at that time, we didn't have, for example, a lactation room where I could be able to, you know, express milk and so on. And I remember asking about it and being told, oh, you know, you can just express in the toilet. Like, would I eat in the toilet? Would you eat in the toilet, Winnie?
No.
But that's where I'm supposed to prepare food for your baby. You know, for my infant, for my little baby.
Whose immunity is still developing, so.
Exactly. You know, but I made it very clear, and I think it's to some extent because I was a senior leader in that organization. I will not come back from my maternity leave until this room is in place. And at that time, there was a bill being developed, I think the breastfeeding bill, that was to put, you know, each organization, I think with a certain number of employees, needed to have this lactation room. So can you imagine a woman who is coming to work, has a little baby at home, you have nowhere to express, so maybe your breasts are engorged. You cannot bring your full self to work. You cannot be fully productive. These are some of the barriers. They seem simple, But these are some of the barriers that women face in getting to the top.
I see that. And when we look at the bigger picture then, and this is as far as our country is concerned, one would say, so how has this gender parity, and especially when it comes to leadership, affected, I won't say service delivery, but also access to some of the services, and especially for the women? What would you say?
Yeah, I think access is a huge challenge across the country, and I don't mean that just for women. You know, that's a problem for a lot of us, for multiple reasons. Geography is a problem. We don't have, you know, we've got in the range of about 14,000 health facilities, 53 million people, close to. We're nowhere near where we need to be. You know, we've got thousands of doctors and nurses and clinical officers, but still nowhere near the thresholds that the WHO recommends as the minimum. You know, like where we should be aiming for, we're not there yet. So access is a significant challenge, and I think it's even more so for women, for multiple reasons. Again, you know, like who makes decisions around leaving the house, who makes decisions around what you're going to finance in healthcare. As a family, you know, yes, we'll pay for maternity, but no, we may not pay for your cough or cold till later. Who makes decisions around whether somebody can go to a facility alone or they have to be accompanied, in which case what conversations can you have with your healthcare provider around reproductive health, around contraceptive rights, around your choices. All of those things may be stifled. And I think over and above that, you know, there are women who are even more significantly disadvantaged. If you come from communities where you really have very little financial autonomy or very little power, and somebody else makes those decisions for you, whether it's your husband or your mother-in-law, if you happen to have a physical disability that limits you from getting to places, you know, those types of additional realities for women can complicate the fact that they are already disadvantaged in accessing healthcare. So I think we see that consistently across the country.
I mean, and Dr. Ann, talking about all those things, they're not new, right? All those challenges, they're not new. Over time, in different platforms, people have held such conversations, but still in 2024, we're still seeing, you know, this kind of disadvantages and inequalities. So one would ask, so is it that the approach is wrong? Or is it that we're not doing enough to address some of these issues so that by the end of the day, we achieve some level of equality? So what is it that we're doing wrong, maybe? Right. Maybe let's start from there. What is it that we're doing wrong? And what is it that we need to start doing right?
It's such a critical question that you pose, but I'll have to start by saying that going back to what Radha said, right? We are trying to change centuries, centuries of culture. So it's not something that can happen overnight. True. But also, just as Radha said, I think we are making progress as Kenya. So in Kenya, for example, in the healthcare sector, women hold 40% of senior leadership position. Contrast this with 28% in India and much less in other countries on the continent. So we are making progress. I think some of the great things that we've seen, for example, are, like, for example, the legal environment has really changed or improved to make the workspace more conducive for women and to make sure that women actually bring their full selves to work. If you look at the Constitution, just starting the Constitution, it actually calls for equal rights for, men and women. Our labor laws, the Health Act that I was talking about, that calls for these lactation policies. We have laws, for example, on sexual harassment at the workplace and so on. So there are very many laws that are coming into place that, support women in the workplace. That said, I think the implementation is sketchy. And I don't think we do enough as a country to track the progress in terms of implementation or adherence to these laws and policies. And therefore, what is obviously very clear is that having the law and the policies is one thing, which is great, but implementing it and tracking the progress and also holding to account those who flout these laws. Like, we still have a lot of sexual harassment, unfortunately, going on in the workplace. Women being asked for sexual favors to get ahead, that still happens. But there are very many women who are not even aware that, that's, for example, a legal case, that they somewhere can take this issue. But of course, they may also try to do that and, get shut down. And so I think a lot more work needs to be done in terms of awareness about these policies that they exist, to women, but to men as well, right? This is not just a discussion about women, and we cannot go very far on our own. We also need to bring on board our male allies, our male colleagues, to support us in this discussion. So quite a bit has been done in Kenya, but I think we need to do a bit more in terms of translating this to action and tracking progress.
I see that. And I'm happy that you pointed that out, because majority of the times when you talk about anything gender, before you even say another word, there's that negativity towards it, like you guys are just talking about women alone, but really we cannot thrive in silos. We need one another to support one another. Even again, like you said, the male counterparts to say, hey, listen, we need lactation rooms for our female colleagues, right? Something like that might seem simple, but it really goes a long way to champion for this right. Dr. Radha, but in as much as we have some of these laws, we have some of these policies, implementation might be sketchy. But there's some women who don't know about this rights. There's some women who don't know about how to go about, first of all, ensuring that whatever is in the policy and whatever is in the law is actually implemented. So some might say, look at it, for example, basic example, the lactation room. Some might actually see that as a favor, be like, hey, our company has this, not knowing that, no, actually, this is what you are entitled to as a woman in the workspaces. So then how do we empower women to understand their rights, to understand some of these provisions that they don't necessarily have to beg for it, but they have to ask and demand for it?
Yeah, I think it's an imperative that falls to all of us. You know, it's I think as women leaders in organizations, I'm sure, you know, we see this, I hope we see this at HealthX and other places. Like we are advocating for that ourselves because we have walked this journey, many of us. But that's not good enough. It shouldn't require you to have a woman, you know, country director or woman CEO to have those things in place. So I think, you know, as Dr. Han said, like male allyship is absolutely critical. Having this be an expectation of all leaders, I think is very important. And you know, you mentioned gender. A lot of people's eyes glaze over when we start talking about gender.
Like, here we go again.
But the fact is, having women in leadership in organizations has been shown to be better for those organizations, has been shown to be better for health systems, for countries. They do better. There is, if you want a business or a financial argument for it, there is one. So, you know, we're not saying to anybody, this is important because it's good, you know, it's the right thing to do. Yes, it's all of those things, absolutely. But there is a very clear sort of business case and a very clear impact case, just as much as there is a rights case. And so I think as people start to acknowledge that, and this is not because a woman is rising up through the ranks, you know, a man is falling aside. There's more and more work, there's more and more things to be done, there's different ways to lead. You know, I think as we start to recognize that actually women in these positions and setting up these positions for competent people, whether they're male or female, to take them. Leaders kind of setting the stage for that, I think will help to address some of this. I recently read an interesting article that was talking about policies and educating women, and it said, you know, there's 3 types of things we need to look at. We need to look at policies and around getting women there in the first place. So what is their education? How do we teach them from young? How do girls learn from young about leadership? How do they learn about their rights? You know, how do they learn about the challenges that they may face around the fact, you know, they're going to have puberty, they're going to menstruate, they're going to have babies, all of those things they have to plan their lives around in some way, so their lives have to accommodate. So getting them there, then keeping them there, what are the systems we put in place in a workplace around mentorship, around peer support, around gender responsive policies, around pay equity. We need to talk about that. And then having them thrive there. So those 3 areas.
Get them there, keep them there, and let them thrive there. Okay,
Uh-huh.
how about we take a break on that note, and then when we come back, we'll pick up from there. Plus, again, still talk about more in terms of financing, in terms of technology, and how do we help women and women leaders, you know, harness, first of all, the power of technology, but also understand and thriving, and especially when it comes to financing and you know, the leadership, transformative leadership, right? As far as what we're talking about, this morning. But again, like I said, we're live, so that means you can interact with us. You can give us a call if you want to ask any question or interact with us on our socials. So that is at NTV Kenya, both on Facebook and on X. Tag me as well at Limbembe_Winnie to go through your questions after the short break. Stay with us. The show is Your World. All right, welcome back. The show is Your World, 35 minutes past the hour. Time really flies this morning. I don't know what's happening. Is it that we're trying to occupy Parliament? Hey, welcome back to the show, okay? And today we're talking about empowering women, and this is especially in the health sector, and this is through inclusive and transformative leadership. And of course, so we're trying to look at the impact of the same, trying to figure out, first of all, why is it that we see, yes, some women who are taking up this positions and thriving in the same, but there's some women who are somewhat, I don't want to say scared, but not taking up, some of these roles and opportunities as far as leadership is concerned. And what is it that we can do to empower women to not just take up these opportunities, but to be transformative leaders and to thrive in those spaces. And this morning, I have lovely ladies with extensive experience as far as leadership is concerned, I want to say, but their journey towards, attaining the leadership positions. Dr. Anne Musuva, who's the Regional Director, East and Southern Africa from Thinkwell. And we have Dr. Radha Kanad, who is a leader, strategy, partnerships, and growth from Health X Africa. Ladies, it's so good to have you this morning, having this very important conversation. But before we went on a break, so we were left at getting women there, right? Keeping them there and ensuring that they thrive in this position. And Dr. Anne, I'm just going to throw this to you. So what exactly does that look like? So does that mean we need to have more role models, and especially for these young women and girls? Or Do we need to change the way we approach the whole question and conversation about leadership and transformative, leadership? How do we get there?
That's a really critical question. I think starts to get to the meat of the matter, isn't it, right?
Yes.
But one of the really important things is just having those women there and having women role models, right, within the organization. And that can only happen if women filter through from the pipeline to the very top. I mean, myself, I grew up in a family where my mom was a career woman, very busy, traveling the country, traveling the world. And so from a very early age, it never occurred to me that I couldn't be this career woman with a career and a family. She was also very committed and devoted to us as her children and as her family. So I sort of got the sense that I could try and have them both. From the very beginning. And so I think just having those role models, but also having mentorship programs. Rather and I have been very lucky to have been beneficiaries of this program called Women Lift, which is a program that it's really about building the next generation of women leaders. And one of the really interesting things that we learned there was about, imposter syndrome. And how often as women, unlike men, we are there, but we are always questioning ourselves. And always remember, one of the very first jobs I applied for, that asked for 7 years experience. And I looked at the job, I was like, this looks so interesting, but it asked for 7 years experience and only had 2. And I remember thinking, I could never qualify. And my husband is like, go for it. And I'm like, but I don't have 7 years experience. Nonsense. Go for it. I applied for it and I got the job and, worked there for very many years and really enjoyed my career there. But the point is, we're always looking for things that, that lock us out of opportunities.
Or sometimes we actually automatically just lock ourselves out.
We lock ourselves out, right? And that's something that, so I think also going through structured leadership programs such as Women Lift and many others, also really important for women to appreciate the barriers that they themselves place on themselves, right? And also how to navigate the challenges that we face and go ahead. But the other thing is action. I'll draw you back to something that, happened, I think last year. Dr. Githinji Gitahi, the AMREF CEO, was on this panel at the World Health Assembly. And, he joined the panel and very quickly realized there were all 5 men, right? There was not a single woman on that panel. And he walked out in defiance. So this was some high-level panel, World Health Assembly, and he said, surely, we can't be 5 men. So it calls for action. It needs for us to be bold, unconventional, sometimes a bit unpopular. I'm sure that decision did not go down well with very many people. But we really need to take action and advocate for spaces that are inclusive and have, women on board. And Githinji actually stepped, he stepped out of that panel and asked, is there any woman here who is qualified to speak? And some lady stepped up and joined the panel, right? But I think what that did is that was a very loud message to the World Health Assembly, to very many other platforms and conferences and so on. And therefore, he used his power and privilege in the position that he is as this global CEO of AMREF to drive this message across. And these are sort of the male allies that we need. So we need action. And sometimes you need to make these uncomfortable decisions in order to drive a point home.
I see that. And I'm also looking at, especially now in the digital space, right? Where, again, there's some women who taken advantage of every single technological advancement that is here now and are thriving in those spaces. But there's some was like, this is not for me. This is too technical. This is too complicated. For me, you mentioned telemedicine when we started the conversation. So then how do we empower women to get it embraced? Because technology is not going away, right? If anything, it is advancing and getting better by the day, and it's up to us to catch up. So then how do we empower women in these spaces that they can get there? We keep them there.
Yes. They thrive there. Yes. I think technology is a very interesting space because how, all of us as women and women across Kenya, how much are we engaging with technology on a daily basis? We are constantly on our phones, using M-Pesas, looking for stuff, communicating with our families, checking on our children, ordering groceries, whatever the range of things we may be doing to keep our lives running. we're using technology increasingly naturally. And I don't mean just in big cities. We are seeing, technology penetrate really deep into communities and people having access to it and learning how to use it. I think there's a challenge when there's been, I think, a lot of conditioning around what are sort of female or girl professions, what are boy professions, which ways do people head, or STEM, mathematics, technology. Yes, there are far more men than women, but how much of that is because, again, we're sort of educated and conditioned to think there are certain avenues that we take as women or not. When I joined and co-founded HealthX, actually, I found I was constantly putting myself down. I'm the doctor. Like, I don't understand the tech stuff. I don't understand the finance stuff. I still do that sometimes. Yes, we have a CTO who's a male. Yes, we have a CEO who's a man. But I do understand. Like, I can speak to it now with great confidence, and I'm invited to speak to the Ministry of Health or others on these topics. And a lot, Women Lift Health was exceptionally powerful for me because a lot of it was around. You've got to tell yourself first, I can absolutely be a woman in tech.
Absolutely.
Who's going to stop me? And I think to Anne's example on mentorship, one of the things that out of that fellowship, somebody said, if you see a woman in leadership, you believe you can be a woman in leadership. And I think to me that struck very close to home, and I thought I need to show up as a better, more confident leader in a health tech space. Yeah, we're learning. I can't program I don't even know the words, right? I can't program an electronic medical record, but I know enough to know where technology can better serve. And I think where I'm bringing my uniqueness and my life experience is to help us say, who are the communities who most need this service? I said, I think to Anne earlier, I think I hope that I am the heart of the organization. I'm the one who tries to hold us true to our vision of a doctor for every Kenyan. Where are the communities that are most needed? Who are we as HealthX? We're not trying to give, much better healthcare to people who have great healthcare. We're really trying to reach communities where there is no healthcare, or there's very poor healthcare, or people have other things that limit their access. And so I think, as a woman leader in a tech space, I'm constantly looking at it from that lens of how can we do better, and how can we reach women who maybe don't use a smartphone, right? Like, how do we expand our technology options to actually meet the technology capabilities or confidence of many different types of populations, not just women, but women are a very important part of it. And certainly, we see more women than men using the service for themselves and for their children, mostly. It's almost a 50-50 split, but slightly more women, which gives me a lot of hope that, we're doing something right.
What is the biggest barrier for this women? I know in some homes it's the man of the house who has a smartphone, and then the woman. As long as you're able to see the father, right? So what is that? Is it culture? Is it maybe access? We're talking about financing. What is the biggest challenge that you see?
I think cost is an incredible barrier. To healthcare in general. We're trying very hard at HealthX to make it incredibly affordable. So it's, for example, in the range of between 250 to 700 shillings for a month's worth of consultations. You can use it as often as you want. But that's not always true, right? So if do you have disposable income in your pocket? Are you allowed and empowered to use it for what you feel you need, or is it there to use for the household? Is it there to use for, for shopping, for food, etc.? So I think there's a lot of barriers. The other part is just access. If families have a phone, which is sometimes the case, who's most likely to have it on a day-to-day continuous basis? Who's most likely to be the one carrying it around? I think those types of barriers are significant, and the barriers, as we said, that we put up in our own minds about what we can and cannot do. Whose permission do I need? To take this step for myself. There's a lot that we're working
I see
to address.
I mean, and I really hope that at some point, yes, we're doing better. We're doing well as a country. There's a lot of progress. But we hope that the next time we're talking about these conversations, we see up to 60% as far as 70 or 90% progress really that has been made. Can we talk about financing? And especially in public healthcare, what are some of the biggest gaps? What are some of the biggest challenges that, again, you have seen over time in your years of experience working in the health sector?
Right. Thanks, Winnie. You know, financing is the fuel of the health system,
True.
right? You can't do anything. You can't go there, you know, can't do anything. We can't achieve these ambitious goals of universal health coverage unless the health system is well financed to be able to deliver that. And there are very many elements of health financing. One is about how we mobilize resources to fund all these ambitious goals. But there's also another really important element, which is about how are these resources allocated. You know, in healthcare financing, we call that strategic purchasing. How are these resources allocated, and to what extent do they meet the needs of the population? And this is just sometimes you see women in leadership coming up, because how decisions regarding how resources are allocated and many other things also depend on, you know, one's lived experiences. That's what you bring to the decision-making table as well. And therefore, you'll find that women in leadership, for example, in the healthcare sector, will advocate for, you know, this benefit package we are designing here, for example, with this social health insurance. You know, does it include the issues that women go through? Do we have screening for cervical cancer and breast cancer there? What does a maternity package look like, right? These are the sort of decisions that women influence when it comes to healthcare financing. Not just women, I mean men, of course.
Too, yeah.
But I think because of our lived experience as women, we're able to bring this on board.
Better, yeah.
You know, add another layer, for example, on disability, right? Women with disability, or just people with disability in general. When we're allocating resources in the health sector, to what extent are we addressing the needs of people with disability, of women with disability? I really like what Radha said, for example, about, you know, having this digital platform, you know, support people with disability. And so, you know, people with disability face very significant health challenges. And so also making sure that we're also allocating resources to address their needs is also really critical.
That's important, yeah.
Going back to what I was saying about how we are mobilizing and raising resources. So Kenya has a very high informal sector, about 80%, and the majority of these are women. So as we are tapping in resources from the informal sector and from the poor, many of whom are women, are we actually disenfranchising them further? You know, to what extent are we eating into the little income that they have as we mobilize resources for these ambitious universal health coverage goals? And therefore, you know, financing plays into so many different areas. Now, I'm just reminded of, there's this senator who, for example, has been, you know, she's leading this bill in parliament about funding pads for all girls in secondary schools. Now, if that comes to fruition...
And now they'll be taxed and,
Right.
Yeah.
But, you know, think about it. Menstruation is not, it's not a choice.
No.
You know, it's not a choice. It's something biological that, you know, all girls go through. But there are many who will miss school because, you know, they don't have access to pads and so on. And therefore, if resources are allocated, you know, for that, there are many girls, young girls will be able then, you know, to go to school, show up completely, you know, improve their education prospects, eventually get better jobs because they went through school and so on. And so I think the big issue about how we allocate resources and making sure that that is inclusive of the needs of both men and women, girls and boys is really critical. And that's also why it's really important to have women in senior leadership position, because they're able to surface up some of these issues based on their own lived experiences.
I say that. And just to add on to the same, Dr. Radha, because reproductive health is your forte, right? It might seem as simple as, but it's just a pad. They missed a pad, you know, she missed several days of school. Hey, you know, great-grandparents, so I would say, but they used to go through this process and all those things that really does not make sense. But we don't see the ripple effect of the fact that this girl lacks sanitary towels for 1 month. So can we address the larger effects on something as simple as missing, you know, a pad, which might seem simple, but it really isn't. It's such a big deal.
Yeah, I think it's you know, and it's such an important issue. I mean, it starts, all of this, to me, all of this entire conversation starts with education. And how much are we disadvantaging girls because 5 days out of a 20-day month or 4 days out of a 20-day month, they're missing classes. And that's continuing on again, with other barriers to their education, maybe they're being encouraged to drop out earlier for other reasons. Families prioritizing resources to a child. There's many other things, but this is over and above all of that, a consistent barrier that follows them for years, right? It's not going away.
Yeah.
I think it starts with that, people's access, young people's access to contraception and reproductive health products. How much do they have control over their choices when to get pregnant or not? All these kind of pieces build up over time to form significant barriers, I think, to women stepping up into leadership positions. I think the flip side of that is we only talk about reproductive stuff when it comes to women, but women have many other healthcare needs, just people with disabilities being one piece. We get coughs and colds, we get upset stomachs, we get chronic diseases, we get all of those things, and they present differently. From a clinical standpoint, they look a little bit different sometimes, and we're not used to necessarily diagnosing them. So how much of that is missed? I mean, when a woman shows up with I think cardiac arrest is a common example that people use. It presents a little bit different. It's not always the typical left arm chest pain. What does that mean? How often are we missing really essential healthcare pieces and not talking about preventive care, not talking about promotive care to women because we think, these are not conditions that affect them when they are. I think the big question for me I struggle with around health financing is there's sort of a feeling that, if we put this money to this reproductive health issue, if we put it to sanitary pads, it's taking away from something else that affects the whole population. So there's constantly this discussion about where resources are put, right? The bigger question for me is, or the bigger understanding is that if we invest in women, right, and bring them into the health, and the International Labour Organization did a big report on this. They said if we brought if there was equal parity between men and women across the world, across organizations, we would have 26% more of the global GDP. So there's more resources being brought in when you bring women into these discussions, there's into leadership, into the workforce. Then you spread those resources differently. But, it's kind of this unfortunate and very negative cycle where across the board you're being disadvantaged. Without people seeing actually there's a huge economic benefit that gives more resources to everybody.
I see that. So then what sort of investments need to be put in place really to make sure that we achieve that, but at the same time also empower as many women as we can, and looking at the larger picture in terms of improving the economy, improving our communities, improving all aspects of our livelihoods really.
So I think some of the things we've mentioned are, for example, the laws and policies. We need to have that conducive working environment that actually enables or provides that space for women to grow into those leadership roles. Going back to our constitution, for example, that provides for the 1/3 or 2/3 gender. So that has helped many more women get into leadership. So the same thing with organizations. I mean, let's look at organizations. Let's look at the C-suite. What specific policies at organizational level do we have that actually enable and support women to get to that very top? Because there are very many women in the pipeline. As Radha said earlier, 70% of women in the health sector, there are 70% of the health workforce are women, in the health sector. But when you go up there, that just suddenly narrows, right? So the women are there. So that means we also have to have very specific policies that are enabling the women to funnel up and get into those C-suite positions. The other thing is also just providing this enabling environment that I was talking about. Whether it's about, having a lactation policy, whether it's about supporting women who are going through pregnancy, breastfeeding, and now menopause as well. We need to start talking about having funds in our office and making these women, comfortable to be able to really show up in the office and, be productive, just as well as their male counterparts. The other thing is as well these mentorship programs that I talked about, like Women Lift and many others. But also more importantly, we ourselves as women, who are in positions of power and privilege and, have made it to a certain level of leadership, also need to uplift the upcoming women leaders, illuminate the path, as other women have done for us before.
I was going to ask you, since you're leaders in your own capacities, what are you doing to ensure that, right, that you lift other women up, because you're there, you understand what needs to be done,
right,
but also some of the challenges that are within, and especially when we're talking about healthcare, and how then can we support these women to say, hey, you know what, don't be scared about this position. Like your husband said, just apply and see, and see what happens. But also in tech, how then do we empower women to take up some of these roles, and not be scared about, no, this is more of a male thing, or this should be someone else's responsibility, but empower them to take up these roles. And some of the women would say, but so we do not have access to some of these mentorship programs. For example, like you said, in our communities, maybe women who do not have smartphones, so might not really understand. So how do we join some of these platforms? How do we join some of these programs? How do we, cut that barrier to ensure that all those women, doesn't matter where you are able to access some of these programs and projects?
Yeah, it's not an easy question. I think there's a whole system of things that have to change to enable that. I think within our organization, HealthX, we are currently at 67 or so % women. And we think that's really important. It brings a huge value to our patients, the people who use us, both from the clinical psychologists and medical doctors. It's a real mix, but it's a lot of women.
Yeah.
And we've had to face important discussions around where we use our space. We're a limited amount of space, but a lactation room was very important. So we gave up something else to have that space in there. So I think, trying to set up structures that allow for that. I go back to education. That's really important. I think the other thing is, how brave are we to look to innovation, to try different things, right? There's an interesting example in Pakistan where they have these examples of what they call doctor brides. So a lot of women go to medical school, then they get married and they drop out.
Okay.
And now there are organizations, there's a really effective telemedicine organization that is training these women in tech, training these doctors in telemedicine, and they are delivering telemedicine to large parts of the country, mostly to other women who don't otherwise access healthcare through telemedicine. It's fantastic. You're putting a needed resource back to use in a way that is culturally appropriate and acceptable to reach communities who have a need. I mean, it's actually the perfect solution, but are we brave enough? Are we innovative enough to try something different? I think Melinda Gates has just, given away $20 million to 12 different people and said, do whatever you want with it, as long as it benefits. Use this to benefit women. Do it how you want. That kind of she's called it, I think, trust-based grant making. It's totally different than the system we currently have.
Not to gatekeep and say, where did you take this?
What's going to happen? It's scary. It's different, but it's leadership, and it's trying to shake things up and say, we need to do something different. And I think, to me, it comes down to that. We can't, if we continue to just try and fit women's leadership and women's growth into existing structures, okay, we'll get somewhere, but we won't get as far as we want to. If we're willing to stretch, try something different, teach our young girls from early about technology, bring older women into using technology for their own healthcare needs. You can really change a country pretty quickly. You can achieve universal health coverage in the next 6 years or whatever we have left as our goal. It's possible. We just have to believe we can do it.
And also just celebrate, some of the milestones again, and celebrate those women who are doing it in these spaces, just to encourage, so many other women to take up these roles. Okay, let's talk about then retention of, female workforce, and especially in the healthcare system sector, public healthcare sector, where just recently doctor strike, right? And a lot of things happened. There were threats that were issued. Many of, unfortunately, of the healthcare workers were actually fired from their places of work. So then, how important is it to ensure priorities? We get our priorities right, first of all, to prevent this from happening, but at the same time, also ensuring that we have enough females. That is retention when it comes to all those challenges, that are affecting provision of services in the healthcare system.
I mean, the strike was really unfortunate. Many people lost their lives, as always do, during a strike that involves health workers, who operate on the brink of life and death. But I think some of the skills that come naturally to women, such as collaboration, empathy, listening, would have been very useful in the negotiation and mediation of this strike. I think if we had many more women around the room, I'm sure this matter would have been resolved faster. But just going back to some of the issues that, you know, the doctors were raising, issues on remuneration, but also difficult working environments, you know, lack of, you know, the equipment and the stuff that they need to be able to deliver care. Those
and human
really are
resources
valid.
as well.
Those really are valid issues that need to be brought to the limelight. I think some of the things around retaining women in the workforce are, you know, for example, we know that health workers work long hours, work nights, so just put a young lady in that situation, in a night call. And so we really need to try to think about what are the needs of our health workers. Men, women, what are their needs when they're working during the day, at night? What sort of protective gear do they need? I read a report, for example, that during the very first during the COVID crisis, the very initial days, all the PPE was sort of, you know, it was initially designed for men. And therefore, even the suits that were being bought were very big and heavy. The masks were, you know, ill-fitting. They're sort of just designed for the male. So just going back to retaining and making women comfortable in the workforce, we really need to think inclusively when we're making decisions about, you know, how to retain our health workforce. And especially the women who are often sort of left behind.
I see that. Okay, so we literally have to end the conversation. Time flies. So then, what would you say, what sort of conversations do you want to see, say, the next time we have this conversation, because I don't want to say 5 years. 5 years is too, is too far. What do you want to see, and especially when it comes to women embracing leadership positions, and not just being leaders, but being transformative leaders? What is it that you would like to see, where you'd be like, you know what, my heart is at peace, I am happy? Would you like, very quickly before we end the conversation?
Wow. I'd love to see action.
Okay.
So there are all these policies that are in place. I'd want to see action, and I'd want to see many organizations and the government start actually tracking progress towards the implementation of all these policies of gender parity, pay equity, and so on, which is still a big challenge in Kenya. There's a huge pay equity gap. I actually remember when I started in government, my housing allowance was different from my male colleagues, and we're all at the same level. I hope that has changed. But so. We need to see, I actually need to see an environment where we don't need to have these conversations.
Okay, I see that. All right, Dr. Radha, what would you like to see?
I think for me, in the short term, I'd like to see more conversations like this. I think it's really important that we bring it out in the forefront. We acknowledge, you know, all of our biases, all of our challenges. I think the conversations are important. The data is critical. We don't even look at the data of how many medical students or nurses drop out of the system. We're not tracking the numbers to say that gender is actually a barrier in all of this. But in the long run, you know, I want to be having a conversation that's not about women. I don't want people to be surprised, right? That there's a woman president or a woman CEO. That's my long-term vision, is that we don't bat an eyelid about whether it's a man or whether it's a woman at that level, because it feels so normal. We don't get upset when there's a panel, you know, that's more women than men or whatever, because it's normalized. Like that's the long-term vision for me, that gender stops being this kind of theme that is driving decision making for us.
I really like that, and I really hope that, again, we will get to that point where we don't, when you mentioned the term gender, we're already like, women, here we go again. No, but we can have a wholesome, holistic environment where both men and women can thrive, and especially when it comes to transformative leadership. But ladies, thank you so much for your time this morning. This has been so much fun and inspiring to just pick your brain on this conversation. So we say thank you, Dr. Anne Mosova, Regional Director, East and Southern Africa, Think Well, and Dr. Radha Kanad, who's the Lead Strategy, Partnerships and Growth from Health X Africa. Thank you so much. All the very best in your leadership positions in your journey towards transformative leadership, and we hope that you continue to empower and encourage so many other women and girls as well to be in spaces where you are in. And of course, thank you so much for staying with us as well until the end of the show. This is where we put a stop, but remember, the conversation does not end here. Keep the conversation going on our socials at NTV Kenya, both on Facebook and on X, and tag me as well at @lubembe_winnie. So enjoy the rest of your day and enjoy the rest of your day as well. See you soon. Good night.
Get ready to have your mind blown.
Yo, what up, party people? It's your boy DJ Exclusive, aka the People's DJ, aka Bazu, and you are tuned in to Kwetu Mix on NTV.
We're bringing you the hottest show in town.
Hey, what's up, my people? It's your girls, your road, the baddest.